Hello, this is the Nelson Group um, YouTube channel. Welcome back. Honestly, I'm very impressed at the way you guys are subscribing to my YouTube channel. I so much thank you all, and I wish you all well. Those that are looking for care job or visa, may it be granted for you. All right. Thank you once again here today. I have received a lot of requests from people asking me to show or do a video for a sample for care job CV, how it looks like. Okay. Just one more time, I just want to introduce to you the Nelson Group channel. This is our website. This is what we do. We process visa. We also help you in terms of getting admissions. We do video creations and cryptocurrency. Okay. We also render personal care assistance to people. And we also run like as an recruitment agency, which we have been doing for a long time. Um, Other things here is the testimonies of people we have worked for, and they testify that truly we are good. If you have a request, scroll down to our website, www.thenelsongroup.com. On the bottom of it, you will see this page. Fill in your name, okay, phone number, email, and send a message to us. We'll get back to you. All right. Okay. Based on today's business, I want to let you know that care job or support work, there are things they are looking at when they see your CV, of which every boss or every employer look for that. When you're talking about taking care of people, you know, do you have the compassion? Do you have human sympathy? You know, can you do the job? They want to see it first in your CV. They want to know. They don't want to waste their time. So you have to moderate, edit, tailor your CV, your current CV you have now, tailor it to suit what they have, what they are looking for, what they are requesting for. Sometimes I do tell people, when you see a job you want to apply, look at what they want you to do. Bring it let it reflect into your CV. Okay. Not let us not waste much of your time. Let's go straight to the business. But before we go to the business, please, if you're watching this video, I just want you to please kindly click the button subscribe. This service I'm rendering, I've gotten a lot of threat from agencies asking me why am I saying all those things on YouTube and making people not to come to them one more. Yes, actually, these are things that the agency charge you, you pay for it, but I'm giving it out free of charge. What I need from you in return is just to subscribe. Send it to your friends and ask them. If you can share it like 10 people and ask them to subscribe. I will be more motivated. I will be motivated to do more, search more. Even when people are collecting money to do it for people, I'm doing it free of charge. Okay. So if you feel this is worth for sharing or subscribing, kindly click on the button subscribe. Okay. Or drop your comments, share to your friends, and ask them to share to their friends too. All right. Now let's go to the business. I have a CV here, a sample CV which stated care assistant CV. First and foremost, you put your name, put your address, okay, number, street, and this one is from someone here in Birmingham. Um, okay, look at it. You put your telephone number and mobile number followed by email. All right. Then you make another point here, personal summary. You write about yourself. If you are hardworking, professional care assistant with a genuine interest, and the days, You know, put all down, put it down. Let they want to see it. You know, it's not easy for someone to just blindly see a CV anyhow and hire the person. You must show it. You must prove to me that yes, you stated this down. Look at what this person put down here. Highly motivated and currently seeking a suitable care assistant position. In what location? If you know the location, you put it. That's why you need to be editing your CV. If you don't know, you just remove these parts. Okay, suit it, let it be what they are looking for. Then you talk about another point, career history, where you have worked so far. Remember, some of this job doesn't require you to have experience, but they just want to see it. If you have worked in any care home or anything related to care, remember in the other video I said majority of us have done care in one way or the other. All right, it may be the one we render to a family member who is sick. Okay, you just put that, even if it's not official, but you remember, okay, maybe you helped in someone somewhere. Then, if you're a nurse or a health personnel in your home country, that is fine. Put it here where you have worked. Put the year. If you're still there, you put it down. You also put down what you normally do. You see, on a daily basis, you can write a short note under it. All right. When you write a short note under it, you now have um a separate place where you list down duties. These duties are very, very important. It will now send a message to the home or your employee that you have the knowledge of what is going to happen, how it's been done. Even if you don't have the knowledge, remember that some of them are willing to train you. All right. So this is what you're going to put down. Number one, say keeping up to date record and patience, including daily observation about activity. Yes, this one is when you are working one to one. That's what we call one to one. One to one is when you are assigned to a particular resident to monitor his activity. Maybe he's aggressive, but they are trying to remove him, stop some medication he's taking because they feel like the level of aggression is reducing. So they want to monitor it maybe for good 1 month. They place you on one to one, ask you to record all the activity. If the resident or the patient is happy or fighting or quarreling with other people, whatever they may be, you record it down. Okay. Then instructing patient on health matters and personal habits to do with hygiene and diet, helping to recognize, and also participate in recreational activity. What I'm trying to let you know that this duty you are seeing here is basically for care home. These are things they are doing in the care home. And if I'm the one to employ you and I'm seeing this on your CV, I will be happy because I'll feel like, yes, you already know what is happening. You already know what is going to look like. Okay. All right. Then you go down here. We stay on it, or this is still the continuation of the duties you're going to do. Then your professional skills. All right. Here is also attributed to ability to identify signs of emotional or developmental problem, knowledge of all related relevant health and safety policy and procedure, aware of all the five procedure, maintaining of document and the monitoring and maintaining of equipment, okay, because they use some equipment like hoisting in care home, okay, experience of looking after elderly patients with dementia and challenging behavior. These are the things. Then another personal attribute, having the required confidence to drive, and you know these are things they needed you to put in your CV for a care job. All right, for a care job, if you're having this thing, believe me, this is up to date UK standard. The key competency and skill. Are you a good listener? Personal care. Do you like taking care of people? Meals preparation, domestic help, accompanying clients in the community, time management, reliability, domiciliary care, record keeping. All these things are what makes you a caregiver. All right. Now, coming down, coming down to this angle. um, you will see where they mention academic qualification. It is opportunity for you to list down all the relevant um, qualification you have gotten so far from beginning to the end. If you want it to be so, then under reference, normally I advise people to put available on request. In UK and some other country, they will ask you to give them email, a working email, not Gmail, but a company. Let's say Dangote Ifeanyi at dangote.com. That kind of email, not at gmail or yahoo.com. So if you don't have any of the organization you have worked with or you know that can give you a reference, it's better not to put it, so that when they give you a particular form and ask for reference, you now have a time to drop it. Remember what I say. Let's go back to it again. Um, you first of all write it, the topic, care assistant CV. You write your name, write your address, followed by a phone number and your own personal email. You put down personal summary. You write some things under the personal summary. Then you put your career history, where you have worked before. Then put what you are doing. If you work in 5 places, make sure you put them, and you also write some short note what you are doing and your duties in all those areas. Okay. Then professional skills. In under the professional scale, you have professional attributes. You explain further what, the kind of attributes you have, what you can offer, and what you have done. All right. You also put down another second personal attribute. You put down all these things are related to care home. Then you talk about the key component and skills. Are you a good listener? Can you take care of sick person? Can you keep record? Then after that, you close it with academic qualification. Then under the academic qualification, you list out all the relevant um, education or qualification you have obtained so far, followed by reference. Under the reference, don't put anything, just put it on request, because definitely they are going to give you a form for your reference to write about you. Okay, guys. Um, Today, this is where we are coming to the end of it. If you have any question, please drop it on the comment section, or you go down on our website www.thenelsongroup.com. You will see down here, you drop your request. Okay, it will get to us. All right. Um, Remember, CV is very, very important when you're applying for a job, especially UK, because they love it when it comes to documentation. Okay, I wish you all success, but guys, remember, subscribe and share to your friends. Please subscribe and share to your friends. Have a nice day. Thank you.